Good morning and welcome to BRR Media. Today I have the pleasure of being joined by Jeremy Skillington, the Chief Executive Officer of POLB Pharma. It's great to have you with us today, Jeremy.
Thank you, Jack. Good to be on.
Jeremy, great news about the European patent granted on your asset POLB 002. Tell us more about this announcement.
Yeah, very happy with this. As we said at IPO, we're building out a pipeline of assets at POLB. Our lead program 001 is going into the clinic very soon, and following that, hot on the footsteps is 002. Now, this is a program we in-licensed from the University of Warwick earlier this year. So it's an intranasally administered viral particle that kind of blocks infectious diseases, both prophylactically and indeed if you have infection yourself. So it's a dual purpose, a dual mechanism. So very excited about this program, and yes, important to get patents granted in this space. It's a very competitive space. So very happy this morning that we have a patent granted to cover 002.
This asset is an RNA-based immunotherapy for respiratory virus infections, which is a bit of a hot topic at the moment. Can you give us an overview of the asset?
Yeah, happy to do that. A bit of a hot topic is right, Jack. I think obviously we've all experienced the pandemic the last number of years. I think we've learned a lot from about viral infections in that time. And again, we were fortunate to bring this program in through collaborations with University of Warwick earlier this year. This is work that Andrew Easton and Nigel Dimmock have been working on for a long time. And they've identified this kind of, as I say, viral particle that actually interferes with the replication of say, if you get an influenza infection, it interferes with that replication of the infected virus. But also it kind of triggers your nasal cells to be active and on alert should a viral happen. So that's why the dual approach of it can help both prophylactically as well as therapeutically. So yeah, so RNA based is it interferes with the RNA side of the viral replication. So again, very clever mechanism of action. And as I say, the team at Warwick has done a lot of really excellent preclinical work to move it to forward to be late preclinical.
So why are products such as these so important to develop at the moment?
Yeah, I mean, again, pandemic related. I think we've all realized that we weren't prepared enough when COVID-19 came along. So I think there's a lot of interest and funding, investment in pandemic preparedness. I think this is an ideal product for that. They've got a manufacturing process in place, so this can be stockpiled. So in case another pandemic come along, and again, it's broadly applicable to multiple respiratory viral infections, such as influenza, such as potentially SARS-CoV-2 and RSV. So the next pandemic, this could be a drug that's on the shelves, ready to go should a new pandemic come along. And again, simply it's intranasally administered, so it's quite straightforward and to administer, and ease of distribution as well as a result. So again, it's it's a product that can enhance our levels of pandemic preparedness. So again, very important for the times we live in.
Thank you very much for the update this morning, Jeremy. We look forward to hearing more in the future.
Appreciate it, Jack. Thank you.